Module 2 of the medication lecture series, we're going to talk around tolerance, dependence and withdrawal. What is tolerance? Tolerance is when the body adapts to something that it's been exposed to. Imagine that you're living in an environment that's colder than where you are now. It may take some time, but eventually you're going to get used to that. Your body becomes tolerant to the cold. And so you don't experience as much of a negative effect when you walk out on a cold, frosty morning. With medication, tolerance is when your body starts getting used to having that medication around, so that the effects that you see when you first start taking that medication lessens over time. When we're talking about pain medications, it means that over time you may see less pain reduction on the same dose of pain medication. Why does this happen? Well, it still confuses scientists as to exactly why tolerance occurs. However, it is something that we see in common with pretty much all of the pain medications. Tolerance can happen to other drugs as well, like alcohol. Part of the reason tolerance develops is because your body gets more efficient at metabolizing the medications. And the organs that the medication is affecting start to become resistant to the medication effects. So the nervous cells and the brain start to shut off their responsiveness to the drugs. Ultimately, what this means is to see the same effect from your medication, you would need to take a higher dose. That may seem like a logical answer, but the problem is that every time you increase the medication dose, you will also increase the side effects. And you may not develop a tolerance to the side effects at the same rate that you develop a tolerance to the desired effects. This can lead to an imbalance where you see more problems with side effects as you increase the medication dose than you do beneficial effect. As a light example, think about when you first bite into a chocolate bar and how amazing that tastes. Then by the time you make your way through it, you don't seem to get quite as much enjoyment and pleasure. And by the time you get to the end, you may be feeling pretty unwell or sick. It's the same sort of approach with medications. As the dosage increases, the side effects are likely to increase as well. The consequence of all of this is we need to ask ourselves that at the time that we start to see tolerance developing with our pain medications, should we be increasing the dosage or should we be looking at other ways of helping to manage the problem? And if the problem is chronic pain, simply using medications is typically not the answer. Tolerance is often associated with a physical dependence. Physical dependence is when the body gets so used to having a medication around that it needs to have that medication to function normally. And if you deprive the body of that medication, if you stop taking it suddenly, you start to develop a sickness syndrome. And the sickness syndrome is called withdrawal. Withdrawal syndrome can be variable depending on which medication you have been on and have reduced or stopped taking. The withdrawal syndrome is masked or avoided by continuing to take the medication. A withdrawal syndrome typically occurs within about 2 weeks of reducing or stopping a medication. Often, the symptoms of a withdrawal syndrome are the opposite to the clinical effects of a given medication. For example, with the opioid medications, the withdrawal is typically associated with increase in pain levels, stomach upset including cramps, nausea and diarrhea, excessive sweating and shaking, body getting used to having reduced exposure or an absence of that medication. Withdrawal symptoms will eventually pass, but it can be quite an uncomfortable experience for the individual. Many people who take medications for pain have had times when they have run out of a script or have been in a situation where they can't get access to the medications they would normally take. So many of you will have experienced some of these withdrawal symptoms from time to time, and it's worthwhile reflecting back on times that you may have had these experiences and make sure that you clearly associate those with reduced access to your medications. It's important because the issues of tolerance, dependence and withdrawal go hand in hand with the long-term use of medications for chronic pain. For patients who continue to use medications for chronic pain, you must accept that these are likely to be part of your clinical syndrome. It means that at any time that you don't have access to the medications that you're using for pain control, you're at risk of developing withdrawal symptoms. This in turn makes you dependent on that medication to ensure that you don't get unwell. As part of the pain management program, we encourage and facilitate medication reduction and ideally medication cessation to shift people away from this dependence on medication. The opioids, typically associated with anxiety, nausea and vomiting, hot and cold flushes, sweating, muscle cramps, diarrhea, and nasal discharge. Alcohol, withdrawal is associated with anxiety, excessive sweating, tremors, dehydration, a racing heart, insomnia, nausea and vomiting, diarrhea, agitation, headaches and potentially seizures. Sedative medications, including the benzodiazepines. Withdrawal is associated with anxiety, a feeling of numbness, dysphoria, or a feeling of impending doom. Intolerance for bright lights and loud noises, nausea, sweating, and muscle twitching. What are the time frames from the onset of withdrawal to the cessation of withdrawal effects? For alcohol, it's approximately 5 to 7 days. For nicotine and cigarettes, it's about 2 to 4 weeks. For the opioid medications, it's about 4 to 10 days. And for the benzodiazepines, such as diazepam and alprazolam, it's 1 to 4 weeks. As you undertake medication reduction as part of the pain management program, you're likely to experience a limited number of these withdrawal symptoms. It's important to report these symptoms back to the program instructors so that they can be aware of what you're going through. Sometimes it's going to seem extremely difficult to undertake a medication reduction or to continue on a reduced regimen. However, once the withdrawal symptoms pass, you'll then be in a position to make a rational decision as to whether you restart a medication, knowing that there may be limited benefit in being on that medication associated with all of those negative problems, such as withdrawal and dependence. In summary, a large proportion of the medications used in the medium to long term for chronic pain are associated with the problems of tolerance, dependence, and withdrawal. The Ascend Pain Management Program aims to facilitate medication reduction and cessation so that patients can be free of the issues related to the utilisation of medications in pain management, such as tolerance, dependence, and withdrawal. If you'd like to know more about the issues around medication tolerance, withdrawal, and dependence, go to our website at www.precisionascend.com.au.